Hey Vestas, Magadi, Saliwanani, Linjani. My name is Panashish Batamoto, also known as the Dynamite Muma Streets, of course. Chinzagasha. I know probably you're wondering, you have a soul in your head, like, so what? Here's the catch. Globally, young people face numerous challenges that affect their security, development, well-being, and Zimbabwe is not an exception. Emerging issues such as climate change, sexual reproductive health, mental health, drugs and substance abuse have been making waves where on social media. So here's the catch. Allow me to introduce the No Podcast, where we get to talk about issues that are affecting young people, unfiltered, uncensored, raw as it is. And I hope you're going to be having insightful conversations where we have young people come through to discuss issues that are affecting them. As it says, nothing for us without us. So Chinzogasha, now you know me. I want to also get to know you. So what you have to do is leave a comment. Tell me your name, where you're typing from, and what topics you would want us to discuss on the No Podcast. Also, do make sure that you like, comment, and subscribe to our YouTube channel and also to our social media platforms. So from me, the Dynamite, and the crew behind the scenes, we're so excited and we hope to see you on the next episode.
Hello and welcome everyone to your favorite podcast. For I know that you know what you do not know, thus the know. I am so excited to have you here today, whether you're listening from home, on the go, or anywhere in between. You know, annually, Zimbabwe has an estimated abortion cases of about 70,000 up to 80,000 there. And the bulk of them are unsafe abortions, where women and girls do not have access to health facilities, even for post-abortion services. Now, abortion, which is one of the major causes of maternal mortality in Zimbabwe, and for us to discuss this fully, drum roll, we have the Women's Action Group. The director is here, Edna Masiwa. You can just say hi.
Hi, hello.
That's Edna for you. And of course, Sandra Muzama, the field officer.
Hello everyone, how are you?
So it's about to get exciting. It's about to get exciting. Now, the first question is we discuss this. We'll go to the director. I would like to know, with the viewers, of course, what inspired you to become involved in abortion advocacy and women's rights in Zimbabwe?
I want to maybe speak about the background of Women's Action Group briefly. We are a women's organization, women's rights organization. We promote women and girls' rights in Zimbabwe. So in our area of work, we focus on different strategic areas, which include gender-based violence prevention, sexual and reproductive health rights promotion. We also work on transformative leadership as well as climate change issues. So you will find the issue of abortion is under the sexual and reproductive health rights pillar. And we are working on that issue because we realize that, as you have already said, many unsafe abortions contribute to maternal mortality in Zimbabwe. With the research that was done in 2016, that showed that more than 65,000 women had abortions in Zimbabwe, and most of those were unsafe. So our issue is around the safety of abortions. And when we are looking at abortion issues, we also have noted or realized that we are still governed by a law, the Termination of Pregnancy Act that was put in place in 1977. We have noted quite a number of gaps which need to be addressed. So this is why we are involved in abortion advocacy work. We are saying women need access to safe abortion in Zimbabwe. This is why we are working on this particular program.
Okay. That's amazing, inspiring, and sad at the same time. The story is inspiring of the work that you're doing, and then sad to hear about all that women and young girls are going through in Zimbabwe. Now, to you, can you just introduce yourself again? How you got yourself involved? What inspired you to get in this journey?
Thank you so much. Once again, my name is Sandra Mzama, and I'm working with Women's Action Group as a field officer working in Bindura, Mashonaland Central.
Okay.
So I became aware of the disparities that women and girls face at a very young age, even at family level, where I wasn't treated the same as my brother or the other boys in the family, even when there are family gatherings. So you'd find that even at school, we were assigned certain subjects. And at one point, I wanted to join the woodwork class, but I was actually inhibited, and they said I should go and join the fashion and fabrics.
Okay.
So growing up, I had to question a lot of these things. Why were women and girls barred in some spaces? Why were we not given equal opportunities to be able to showcase and also utilize our skills and also maybe achieve our dreams the same way as our male counterparts? So this ignited my passion to advocate for women and girls' rights, even in the community, even at church. You'd find that you'd hear there's a pastor, a female pastor, pastor so and so, but you never ever see them executing their duties as a pastor. You never see them preaching. You never see them as active and contributing meaningfully to the gospel as their male counterparts. So this ignited my passion to find platforms where I could exercise my voice and where my voice could be heard, challenging the status quo for women and girls. And especially when it comes to provision of reproductive health services, and also even the information around reproductive services for girls and women even growing up, it was subjects that were not openly talked about. Even the way you were socialized, even at family level, you were just told in very equivocal kind of manner. It's not clear what are they saying. It's just in riddles. It's so ambiguous. You don't understand even as a little girl growing
it's not
up.
straightforward.
So I had to seek out platforms. I had to seek out education so that I get the correct information on what it really entails for someone to get pregnant, what contraception means, and what are the policies in place for me even as a young woman growing up, even for my friends. What information is there? What are the policies that are in place in the country so that I could be able to cascade this information to others? I've always been vocal. Even growing up. I'm not a very loud person, but I'm vocal in terms of maybe
you're
challenging.
vocal, not loud.
Yes, I'm vocal in terms of challenging inequality. I become very passionate when I feel that
I see. I'm feeling it already.
Yes, the playing ground is not equal. So I had to find a niche. I had to find information so that when I go into the public sphere, I don't waffle. I go there with information. And
Correct
I have information in my fingertips. I know what I'm talking about. So I had to do this through education. I had to get a good education. I did a lot, and I'm still doing a lot of volunteering. Wherever I see an opportunity that needs my voice, an opportunity that needs my skills, my presence, I'm willing to be there. And which also comes to the point where I got this opportunity working with Women's Action Group in Bindura. And I've also done a lot of community organization where I work with different stakeholders and other organizations in our communities and other support groups as well, so that ultimately we put forward the agenda for women and girls' rights.
Awesome, awesome. That's quite an introduction. Thank you for that. Now that you mentioned the Termination of Pregnancy Act, did I get that right?
Yes, I did.
I,
Yes.
I would like to know that in this our country, in our context, what are some of the challenges that you are facing as WAG in advocating for the changes to this Termination of Pregnancy Act?
Firstly, one challenge is the stigma that is associated with abortion.
Okay.
If someone hears the word abortion, they cringe, they
That's right.
already cringe.
Yes.
But we are saying abortions are happening at community level.
Yes.
And we should recognize that we have a problem.
Yes.
So it's like abortion is something that people shy away from discussing at all levels. So that one is a major challenge, because whenever you speak about abortion, you find there our communities are not even aware that we have a Termination of Pregnancy Act,
Yes,
which
that's true.
allows for termination where there has been unlawful sex, that is incest and rape. It also allows for termination if the condition of the mother of the woman is in danger, as well as when the fetus is grossly malformed. But sometimes you actually hear people saying, I would rather give birth to a disabled child than terminate the pregnancy.
Okay.
It's all because of the stigma and lack of awareness. So what we are seeing currently is even those who are eligible to get safe termination of pregnancy
Okay.
are
There are
not
those who are
doing so
eligible.
because they do not have the information.
That's right,
They don't
okay.
even know that we have such a law. So I think that's a major challenge. So we need to educate communities on this law that is there.
Yes, that's right.
There is also a program that is the government has put in place, which is on post-abortion care.
Okay.
If a woman has had an abortion, a termination of pregnancy, they are allowed, they can access post-abortion care in
So-
any institution.
This is actually to say the government of Zimbabwe has put some legislation to actually cater for our young girls and women who are going through abortion.
We cannot say it's a legislation, but it's a policy.
Okay.
It's a program that has been put in place by the Ministry of Health to save the lives of women. After realizing that women were dying from complications
Yes.
of unsafe abortions. So we now have a post-abortion care program that allows women to access services.
Okay. Yeah, it's getting hotter and hotter. Okay, but the field officer can help me here. What could be some of the reasons why our young women abort from the interactions that you get from the community? Since you said you relate much with the community, what are some of the reasons that they give?
So the main challenge with our communities and the main challenge with our country is that we are lacking of comprehensive sexual education from a younger age. So you find that most of our young girls, they become vulnerable because they do not have information
Yes.
on sexual education. And also even at family level, it is shrouded in mystery. It is a topic that you cannot openly talk
Yes,
about.
that's
So
true.
this makes our young people, or even women, we can't only talk of young women when we talk of abortion.
Yes.
And even women, they find themselves they found themselves vulnerable when they fall pregnant because they do not actually have the information even on the access of where they can access contraception. And also because the laws, some of the policies that we have, they actually act as a barrier for young people and also women to get contraception at health facilities. You'd find that the service fees could be high, and also we need to deconstruct our social norms, because some of these social norms are so retrogressive and they propagate stigma and discrimination such that women and girls cannot readily go
Yes.
to health facilities to access contraception.
Yes.
And also some of our health facilities are not youth friendly.
Yes.
So having all these underlying challenges, it makes then our girls and women vulnerable such that they cannot freely access services, and sometimes they cannot afford the services.
Yes.
And in
Most of the
even
times.
dire circumstances, they don't know about these services.
Yes, they don't
So
have
they find
information.
themselves pregnant, and even when they are pregnant within the stipulations of the law that they can get a legal termination, some of them do not know, and some of them would rather shy away from the legal and go to the backyard because they are scared of the stigma and discrimination attached. Because once you have a legal abortion, then it's out there in the open, and you won't be free because of the tags and the names that you're going to have to contend with in the society. So those are some of the push factors, I think, that maybe push girls and women to have abortions, especially these clandestine backyard abortions.
Okay, these backyard abortions, you say. Do you have an idea of how they are doing it? What are they using? What do they say they are using?
You're putting me in the spotlight. So one thing to note, even us as researchers and organizations that are working in this area, is that these backyard abortionists, for lack of a better word, or these people who perform abortions, they are very secretive. That's why people prefer to go to them. It's because they are very secretive. They keep their trade under very dark curtains.
Yes.
Because one, they want to maintain their business, which is flourishing, by the way.
Okay.
And two, because of the law, abortion is not open for everyone in Zimbabwe at the moment.
Okay.
So, and it can attract a fine or 5 years in prison at the moment. So it is some of the reasons why they shy away. But from those who are willing to share, because where I stay in Bindura, there's actually a notorious place which is called Mabanana. It's a banana plantation. And most women and girls prefer to go and do those backyard abortions there because it's sort of like an isolated place and it's covered in with banana trees. So they usually, and some of them go even a long way to dumping fetuses there. So some would say they use needles to perforate the uterus. They use sharp instruments, and some would use traditional medicines. You are given a concoction, you drink, and then that induces your abortion. And for some who have a little bit of money, they use less safe methods where they can probably get a pill from maybe a nurse or a doctor, and then they perform the things at home. So those are some of the ways. They are really gruesome if you try and zero in the methods that are used. And just from a layman point of view, you can actually tell they are very unsafe. And so probably a medical recommended strategy can be used instead.
Okay, because I've heard of hangers, and I've always wondered how can someone actually. Anyways, this is the discussion we are having today. Now, Edna, you mentioned something along the lines of some being allowed by the law, or maybe there is provision for some to actually have an abortion. Now, for where the termination is allowed in these 3 circumstances by the law, which you mentioned, what are the limitations to access, if any?
Okay. Firstly, I think I already spoke about the knowledge levels.
Yes.
Communities are not even aware that there are circumstances where abortion is allowed legally. That's one of the reasons. And we are also looking at the places
Yes.
where women can go for abortion services. Sometimes if someone is raped and they live out there, there are processes that they have to go through. You
Okay.
don't just get an abortion because you have been raped. You have to report to the police, then to the health sector, and then the case has to be taken to court so that you are given a certificate to terminate the pregnancy.
Yes.
So what we have found out is sometimes women have no money to get to the nearest hospital or to the nearest police station. And sometimes there is also money that might be required for the women to have ultrasound scan to determine the gestation period of the pregnancy, because there is a given period where abortion it can be allowed. After a certain period, you then cannot access safe abortion.
So are we saying it's a matter of class here? Because it seems like when you do not have money, you can't really go through abortion.
Not really in this circumstance.
Yes.
It's not like a class issue. But when we are looking broadly at abortion issues, yes, it's a class issue where someone who has money can fly to South Africa and get a legal termination. And sometimes women can also access legal termination from doctors here in Zimbabwe. It's an open secret, but women can access safe termination. So yes, we are saying when we're looking at abortion, it becomes a class issue where those who have money can access the services. But getting back to women who I was talking about earlier on, where I'm saying sometimes you are asked to get an ultrasound scan, and you have to pay for that scan. That can be a deterrent for someone to get a safe termination, because maybe by the time you get the money for the ultrasound scan, the gestational period won't be allowing for a safe termination.
Okay. Yeah. Next, I would like to hear from the field officer. Since this is the work that you are doing, you're the one who is in the field. Can you share some of the success stories of the work that WAG is doing, of champions maybe that you have helped in Pintura there?
All right. So some of the success stories pertaining the work that WAG is doing, it's maybe the provision of, they were part of some of the organizations that pushed for the provision of post-abortion care, because WAG is also part of the SAC, the Safe Abortion Coalition in Zimbabwe.
Okay.
So they are pushing and lobbying the government continuously for them to open up these safe abortion spaces for every women to access.
Yes.
And so far, the biggest win or gain has been the provision of post-abortion care without incarceration.
Okay.
Because previously, when a woman is maybe manifesting symptoms or prognosis for an unsafe abortion,
Yes.
she would be arrested. But
Okay.
now you can actually go and access.
Mm-hmm.
So in Pintura, we are also working with community champions. We have
Yes.
community champions in Pintura Urban and also Pintura Rural.
Okay.
So in Pintura Urban, when I already mentioned the banana issue,
Yes.
we've roped in local government in terms of some of the councillors that are found in and around Pintura. So we've actually pushed them to cut down those trees, and a significant portion of those trees have been cut and they are being cleared now.
Okay.
Meaning that those backyard people who perform abortions on the women and girls no longer have space to operate in. So that is one of the biggest wins that we've achieved in Bindura. Also, these community champions, besides the limited resources because of limited funding, especially towards safe abortion in Zimbabwe, they do community dialogues with farming communities around Bindura, because you find, like what Maima Siwa was saying, there's a lot of myths flying around. There's lack of, the knowledge levels are very low. And there's also that stigma and discrimination. And there's also maybe resistance from some reservation groups like the church, the traditional leaders. So they are going around doing community dialogues, trying to demystify, raise awareness, and also sensitize communities on the availability of, albeit limited, provisions of the law with regards to safe abortion, and also the provisions of the law with regards to the availability of post-abortion care for every woman and girl in the country.
Okay. Edna, do you have anything to add?
Yeah,
to the success stories?
I think our success stories are around supporting women and girls to have ultrasound scans done. We have a small fund that we have put aside where we assist women so that they get the ultrasound that is required for safe termination in time, so that they have the termination in time. We also have been able to address issues of stigma and discrimination that is related to unsafe abortions through values clarification and attitude transformation trainings. We have trained the media for positive reporting. And I'm sure you have noted now, as they report issues of abortion, it's no longer negative. It's like there is positive reporting on issues of abortion. And we also, through awareness raising at community level, and we also find that stigma levels are not as high as they were in the 90s. So yes, we are scoring successes, but I think our aim is to have the law reviewed. That is our aim, and we are working towards that. I want to say we are now part of a Safe Abortion Coalition, which is a group of organizations in Zimbabwe who are working on issues of abortion. So that is also a success.
Yes, that's a milestone, indeed.
And the fact that there was that research done in 2016, for us it was a success, because we have always talked about abortion using estimates. But there was this evidence. There's this evidence which we now have, which really speaks to the numbers, how many women are affected. So we now have evidence in our advocacy.
Wow. Wow, that's great. Do you think men have a role to play? And what is the role that, if it is there, what is the role that men can play in safety and bodily autonomy of women?
Definitely men have a role to play. I'm talking about this Safe Abortion Coalition. We also have males in that in the coalition. And when we are talking about sexual and reproductive health and rights, and when we are talking about pregnancy, there's a man somewhere there. So they have to be they have to be involved in our advocacy work. And I want to say we are so happy from the support we are getting from males, starting from even advocating for access to services, sexual and reproductive health rights services. We have groups of organizations led by men who are also involved in the work. And I want to say, even in the hospital, we have male nurses offering, male doctors offering the post-abortion care. So yes, males are part of the program, and we are so happy to work with men.
Okay. That's amazing. That's amazing. I'm also here to support and work with you.
I was going to talk about this program. Here we are. We are recording the program, and it's all men and the two of us only as females. So yes, males are involved.
Now, on that, Sandra, I have a gender E. and I want to know, in few words, what does the future look like for women's rights? Is the future female?
So yeah, in a few words, but I cannot put it in a few words, but I'll try. So it's sufficient to say we are on a steady trajectory as it stands in terms of achieving the required or the desirable women's rights, because a lot of work has been done, a lot of advocacy, a lot of lobbying, a lot of information is out there, but we still have some barriers which are really some stubborn barriers which we are still grappling with, so that we really come to a point where we say we have really achieved equality and equity for women and girls in our communities. To maybe on a positive note, I applaud the recent global protocol around SGBV for women and girls. I think that's a positive light in terms of achieving women's rights. So if we can all adopt that, even at family level, community level, and national going up, I think we can go a long way, because it is not what it was back then. Even if, like, when Maima Siwa was narrating the history of what it was when they started this movement and what it is now, you can see that there is light, but a lot still needs to happen for us to really come out and say we have achieved.
Yes. On that, Edna, what she's saying, as you know, much some would say, Chiringa is what you do. We definitely not out of conversations, but we're running out of time. So as you give us your parting shots, maybe you can tell us what's future goals when it comes to women's reproductive health rights in Zimbabwe.
For me, as I said earlier on, we are looking forward to having the Termination of Pregnancy Act of 1977 reviewed. We are looking forward to circumstances where abortion can be offered to women, are expanded, they are added. At the same time, we are celebrating the judgment that was given to Wilson, where we are now waiting for confirmation of that judgment at the Constitutional Court, where girls who are below the age of 18, where the judgment said they could be allowed to terminate pregnancy because that is rape. And where we also found that judgment allowed for women who are raped, marital rape, married women who are raped, to have termination. So that's what we are looking forward to, and we are looking forward to access to reproductive health and rights services in all way, for everyone, for males and females, young people as well as the older ones.
Wow, that's amazing. Thank you for tuning in. Thank you, Sandra. Thank you, Edna, for educating us. If you like this episode, don't forget to leave a comment, review, subscribe, like to the know. And now you can see that you know that you didn't know stuff that you now know about abortion. Until next time, the know.
Hey Vestas, Magadi, Salibonani, Linjani. My name is Panashish Batamoto, also known as the Dynamite Muma Streets of course, Chinzwagasha. I know probably you're wondering, you have a soul in your head, like, so what? Here's the catch. Globally, young people face numerous challenges that affect their security, development, well-being, and Zimbabwe is not an exception. Emerging issues such as climate change, sexual reproductive health, mental health, drugs and substance abuse have been making waves. Where? On social media. So here's the catch. Allow me to introduce the No Podcast, where we get to talk about issues that are affecting young people, unfiltered, uncensored, raw as it is. And I hope you're going to be having insightful conversations where we have young people come through to discuss issues that are affecting them. As it says, nothing for us without us. So Chinzwagasha, now you know me. I want to also get to know you. So what you have to do is leave a comment. Tell me your name, where you're typing from, and what topics you would want us to discuss on the No Podcast. Also, do make sure that you like, comment, and subscribe to our YouTube channel and also to our social media platforms. So from me, the Dynamite, and the crew behind the scenes, we're so excited and we hope to see you on the next episode.